Good morning, Arizona. I'm Lulu Falk, here with Kenzie Vanderpool. Today we start our broadcast with a shocking story. This morning, the daughter of Rick Santorum, former senator of Pennsylvania, was hospitalized. She was born with the devastating trisomy 18, which is a rare genetic disorder that is often fatal. This disorder is more commonly known as Edwards syndrome. This is the second most common trisomy condition.
Bella Santorum, age 3, is currently in critical condition and under care in the ICU in a local hospital. She was found to have pneumonia in both her lungs. Doctors are working to try to fix the medical complication as soon as possible. It is crucial that they work quickly because those affected with Edwards syndrome tend to be more heavily affected by common sicknesses, such as colds, and they can often result in death.
Edwards syndrome affects 1 in 7,000 live births, and 80% of those affected are female. 95% do not make it to birth. Unlike Down syndrome, Edwards syndrome is usually associated with a short lifespan, with most of the babies dying before birth, and a mere 10% of those who do survive will not make it to their first birthday.
Now to tell you more about this tragic condition is Julie Monsine with Dr. Miller. To you, Julie.
Hi, I'm Julie Monsine on the scene, and I'm here with Dr. Miller. Dr. Miller, tell me please, what is trisomy 18?
Trisomy 18 is a genetic mutation that results from having all or part of an extra 18th chromosome. It mutates all of your internal organs, making your lifespan much shorter than usual.
What causes Edwards syndrome?
It is caused by non-disjunction, where the genetic information gets mutated during cell division.
What are the symptoms of this syndrome?
Symptoms include kidney and heart malformations, such as horseshoe kidney, narrowing of the blood vessels in the heart, an esophagus that does not connect to the stomach, cleft palate, club feet, and clenched hands.
Could you tell me more about the club feet?
When the infant is born, they go through joint contractures, or when their joints stiffen. There is abnormal fibrosis or buildup of muscle tissue, causing shortening in the muscles and not allowing extension and flexation in the affected joints. And club feet, the tendon is shortened, causing the foot to rotate inward. This causes club foot, and it appears the person is walking on their ankles.
How is Edwards syndrome diagnosed?
There are multiple tests during and after pregnancy, such as MRIs, ultrasounds, CAT scans, x-rays, and genetic testing. You start with a screening test, and if that comes back saying you have a possibility of Edwards syndrome, then you take a diagnostic test.
Are there currently any treatments for Edwards syndrome?
At the moment, there are no cures for the disorder. Parents can go through palliative care, which is specialized medical care for people with serious illnesses. It focuses on providing patients with relief from the symptoms, pain, and stress of a serious illness, whatever the diagnosis. The goal is to improve the quality of life for both the patient and the family.
What are the hardest things parents of affected children face?
The hardest things parents tend to face is blaming themselves. They think it is their fault, but this is not true. Edwards syndrome is not something that can be passed to offspring. It's completely random.
Thank you, Dr. Miller, for your time. Now back to you in the studio.
Thank you, Julie. Trisomy 18 is very similar to trisomy 13. Both are supported by an organization known as the Support Organization for Trisomy, or SOFT. SOFT is a group that was founded in 1980 by Dr. John C. Carey and Chris Holliday, who had a daughter, Carrie Deanne Holliday, that was born with trisomy 18 and survived longer than her doctors had predicted.
This nonprofit organization helps raise awareness and provide support to families during prenatal diagnosis, the child's life, and after the child's passing.
For more information on SOFT, you can contact them at trisomy.org or call them at 1-800-716-7638. Donations are much appreciated.
Have you and your family been through any treatments?
Well, there are no cures for the disorder, as you know, but we do go through palliative care and several therapy sessions. and it's mostly just to make sure that we are okay and we are all right with letting Bella go when it's her time. And the palliative care is all about giving Bella the medicine that she needs so that she is comfortable during her time here on this planet.
What things have you witnessed with Bella?
Well, some nights she just refuses to eat and you can't get her to eat anything. And I've seen her stop breathing a couple times and she's turned blue and she's needed CPR. Those were probably the scariest, I think.
Has your dad's campaign affected the situation with Bella in any way?
I mean, obviously, it's hard not having him around as much as we're used to, and it's definitely easier to have two parents, one to take care of Bella and one to help take care of the rest of us. But I think given the circumstances, we're managing pretty well. I mean, obviously, he's still around. When Bella was in the hospital, he took time off of his campaign to help her, but it is definitely more difficult. Yeah.
Best wishes to you and your family. Now back to you in the studio.
I'm Lulu Falk, wishing you a spectacular day, Arizona. Stay classy.